Absolutely fascinating. Thank you, Matt, for those insights. A couple of key takeaways for me was the real focus on equity and how amazing to think that half of all healthcare interventions in the NHS by 2013 will involve genomics, and also that program to do whole genome sequencing in 150,000 adults and also sequencing babies as well. Just fantastic. So we're going to stick with genomics and we'll move a little closer to home now with our amazing Tiffany Boughtwood. It's the third time she's spoken at Cannes Forum, but this is the first time as the inaugural Australian Health Genomics Commissioner, which she'll be guiding the work of the newly established Genomics Australia and advising the federal government based on engagement with the genomics sector and the community. She has more than 25 years in molecular biology and management and genetic and genomic research. Please welcome her back to the stage in this new role. Tiffany, come on up.
Thank you, Sophie, and it's lovely to be joining you again for my third Cannes Forum presentation. My goodness, it's been quite a time. 2016 was the first time I joined you here on Ngunnawal and Ngambri country to share my thoughts about the opportunities of genomics, particularly in care for people with rare and less common cancers. So I'd also like to thank the organisers, for the invitation to join you, but also for scheduling me right after Matt, sharing the NHS Genomic Medicine Service and Genomics England. Certainly his reflections on that political will to help drive implementation and identify genomics as a sort of system-changing opportunity and a life-changing opportunity for patients, I think is a message that has come through very strongly with Genomics England and the investments in the UK. And we're also on that journey. It has been with sort of the presentations over the last 9 years and joining you here at Cannes Forum, we've travelled together on this journey where Australia is making significant investments in genomic research through the MRFF and the NHMRC, and also programs like, Omico and Zero, as Matt alluded to. And I do acknowledge that, the challenge of translating those excellent research outcomes into practice is one that we're very conscious of. And so, now we have, with this great potential and this great legacy of genomic research investment, we're now at the point that it's time to translate that, embrace that as part of health system change and see this being embedded in clinical practice in Australia. So it's an important agenda, and it does align with broader health strategy and policy around longer-term outcomes and equity of access and reducing disease burden and improving patient experience. And genomics and precision care for those with cancer, and particularly rare and less common cancers, must be at the heart of that. So our Minister, Mark Butler, who will be joining us imminently, announced the establishment of Genomics Australia in November last year. And this announcement of standing up a specific genomic body within the Department of Health and Aged Care was so significant also around sort of the recognition for sustained funding, the opportunity for getting additional programmatic funding to drive progress in this area. And the announcement specifically called out the importance of national leadership and coordination. The theme of the fragmentation and the challenges of shared responsibility for delivery of healthcare in Australia. This coordinating role is one that we've heard from stakeholders, was acknowledged in the announcement, and we're still seeing in the discussions as we bring forward with the states and territories. So I just want to touch on the governance and the structure of Genomics Australia, just to give you the whistle-stops tour of what we're establishing and what we're doing. So the governance will be a key mechanism to reflect not only reporting lines within Genomics Australia and through government, but also identifying key stakeholders that will be informing our policy and priorities. And I'll be unpacking these over the next few slides. Initially, I'd like to focus the structure within Genomics Australia, and I'm delighted to have Renee Lucchese, General Manager, joining us here today. Please go and say hello at tea. So Renee and team in the establishment phase over the last 12 months or so since the Minister's announcement has been working very hard to develop a structure for Genomics Australia that not only leverages the rich genomics expertise that we have across our ecosystem in Australia, but also builds upon public service expertise and policy expertise. So I'll be, going through this a little bit in the slide. We have the Innovation and Integration section, which is led by Mathilde Desselde as the Director. Then we have Matilda Hayes leading the Community Impact and Partnership section. And Claire Donovan is Director of the Genomic Governance and Engagement section. And on this slide, I've sort of given you a bit of a flavour for the expertise and the multidisciplinary expertise that this team brings together from across sort of health policy, engagement with communities, health technology assessment, from both the MBS and IHACPA, bioinformatics, diagnostic testing. It's really a wonderful team that's been constructed to bring different perspectives and lenses to the activities that we know we need to progress in partnership with you all. In the complex ecosystem that underpins genomic innovation in Australia, the interplay around translation, care delivery, the community sector, patient support and advocacy organisations and industry, this collaboration is essential if we're going to progress genomics at scale and equitably in Australia. Partnership with the states and territories, in delivery of genomic healthcare goes beyond sort of the shared responsibility and funding of hospitals and workforce development. But also we've got the refresh of the National Health Genomics Policy Framework that is currently being finalised based on consultation feedback. Thank you for all your responses and input to that draft. And then beyond that, we hope to continue the discussion with the states and territories about the evolving role and structure of Genomics Australia as we move forward, and whether it would, a structure within government or with more shared governance and funding with the states and territories is the best option to really progress and shift the dial of available genomic healthcare for Australians. And this is where the health technology and genomics collaboration is such an important part of the Genomics Australia governance structure to ensure that we're still having those robust discussions with our colleagues in the states and territories. We're working through a consultative process currently to design a culturally appropriate engagement mechanism with Aboriginal and Torres Strait Islander organisations. The team, through the establishment phase, has been developing relationships, particularly with the Australian Alliance for Indigenous Genomics, and acknowledging Azura in the front row, and led by Alex Brown, as well as the National Aboriginal Community-Controlled Health Organisations, to make sure we have an Indigenous-led and collaborative approach to progressing priorities, both through the framework and informing Genomics Australia activity. And, this consultation to date has been collaborative and productive, and we really look forward to working with these Aboriginal and Torres Strait Islander people and organisations as we move our strategy and priorities forward. So what are our initial priorities of Genomics Australia, I hear you ask? Well, this audience, I know, will be delighted to see that improving access to personalised cancer care has been identified as a key priority for our first sort of horizon of Genomics Australia in terms of our planning. Part of this too will be exploring and addressing the barriers to translation of promising research innovation that, is clearly making a difference. It's cost-effective, it's clinically effective. Why is it it's a challenge to have equitable uptake of these research? Certainly, and I've mentioned, building and managing partnerships with Aboriginal and Torres Strait Islander people is a key priority, as is fostering formal relationships with nations like England that are sort of leading the way in terms of genomic practice to ensure that we're learning not only from their successes, but where they would have done things differently had they their time again. Understanding community perspectives, both from patient support and advocacy organisations, those with lived experience, and the public around priorities, values and expectations for genomics will be a critical part of informing Genomics Australia's work, as is building and managing networks across the sector where we all interact with genomics. And activities under the agreed framework, when finalised, will also be part of our to-do list. All these various priorities fall into those three different sections, so the structures within Genomics Australia, and are being progressed by those teams, just so you can identify which director to tap on the shoulder next time you see them. So, of course, I'd like to delve a little bit more into this specific project with this audience. So the basis for this project was really around recognising Australia's current reliance on access to precision oncology and comprehensive genomic profiling through research. And, moving forward, we cannot continue to rely on short-term research projects for the purposes of providing patients with access to personalised therapies and comprehensive genomic profiling. So this project will undertake an exploration of international exemplars, and we met with Ness and team yesterday, and apparently a lot of that work in the paediatric space is done, so that's awesome. But also, collaborating, working closely with, Ness and Zero and David and Omiko to make sure that the work of those programs are informing our means to address improving access to personalised cancer care in Australia. Importantly, having this project future-focused and patient-centric and recognising the ecosystem in which we work is a critical aspect of this. Where do you fit in? So we're imminently about to invite expressions of interest to join the Genomics Australia Advisory Council. This will be a small working group. It's not a cast of thousands. We really want people who are willing to roll up their sleeves and work on progressing the activities within Genomics Australia. There's also more extensive opportunities for engagement through these networks that we're establishing. So I really encourage you to keep an eye on our website and certainly join those networks to join the conversation as we're progressing Genomics Australia's work. A quick shout out, I'd like to congratulate Rare Cancers Australia on the Now It's Personal report. I was really pleased to see the preeminence of data throughout that report as a critical enabler for improving the experience of people with cancer and how we manage this at a national scale. The relevance and importance of PROMs and PREMs as evidenced by the number of people with lived experience of cancer in this room and how important these voices are in shaping not only priorities of healthcare but also understanding the impact of interventions. Precision oncology, of course, and the theme that came through again and again in the report about the importance of national coordination. So Christine did want me to touch on sort of the vision and ambition for Genomics Australia. And again, it's a bit cruel coming after Matt, but regardless. So we do envisage a health system which routinely includes health genomics and equitably provides access for people to have genomic-informed healthcare in Australia. Oh, that's gone weird. Don't know why the font's gone odd. Sorry about that. In more detail, that involves having sort of empowered consumers, enabled workforce, digitally informed practices, and a national processes and strategies for genomic information management, and fundamentally that national coordination and collaboration across the ecosystem, leveraging Australia's strength and expertise and really moving collectively on this journey towards improving access to genomic informed care for Australia. So I look forward to working with all of you, and please join us on this journey with Genomics Australia.